I just think it's rude, ignorant, thoughtless.
Your risks far outweigh the benefits.
It's up to me to weigh up the circumstances that I'm prepared to risk.
I just need to have my testicles checked. When I swing over, they sort of go glump.
Oh. You're in pain, Mum.
Oh.
Doctor, can you put your finger on my bum, see if I've got a lot of poo up there?
I mean, if I was good to go, fine. But I don't want to find I'm going to spend months almost like a vegetable.
There are some risks of people having a stroke. The worst case would be that you didn't make it through.
Yeah.
Good morning, Putney Mead, how can I help?
That will be Dr. Neal, and that will be between 9 and 11 this morning.
We've got one appointment left, 8:38, that's doing well. I remember sometimes for 8:09, we've booked it all out, literally.
So, because we've got a bit longer, what I've done is sort of made a bit of a list of things to talk about. So, why don't, before we go into that, were there other things that you wanted to talk about today?
Doctor, can I ask a question? If a woman is married to a bloke and he beats her up, like black and blue, right? And she comes and sees the doctor and he says, where'd you get that? And you said, is your husband beating you up? And the mother, turns around and says to the doctor, yes. Can the doctors do something about it?
Why did you ask that?
Can they do that, doctor? I know everything's changed now.
What makes you ask about that now?
No, it's... I wanted to ask you.
Well, of course, we could always help.
I wanted to ask you, didn't I, Richard?
Yeah, because we was
I like
that trial and retribution.
Oh,
it's like...
It's always like this, Doctor. A man shouldn't hit a woman and a woman shouldn't hit a man. See, so...
No, we never done nothing, nothing's done nothing like that at home.
No.
The staff have been very good.
Yeah, okay.
Anyway.
But you two are all right?
Yeah, fine.
Yeah.
And you said you was going to mention the doctor earlier about your bum.
Every time when I eat something, he goes right through my stomach. It gives me diarrhea. And my bum has been very sore. I've been wiping it, but it's been very itchy.
Okay.
And when I go, I pass winds in my bum.
Yeah. What about pain in your tummy? Are you getting anything?
No.
Does your tummy get bigger, have you noticed?
No.
No, it doesn't sort of puff out.
Yeah.
Okay. And from what you've said before, it sounds like there hasn't been any blood in there or anything.
No.
No, good. Okay.
No.
Fine. Is it better when you're not going to the loo so often?
I know when I do a big poo, my bum gets very sore.
Yeah.
Oh, it's very sore.
Okay.
You have to give it a few flushes before it really, gets rid of it.
Yeah, yeah.
You know what it's like, Doctor.
I do.
Yeah.
Oh, dear.
Hello.
Good morning.
How are you?
Not good, not good.
Oh.
I had the worst cough and cold I've ever had in my life.
Did you?
I had paroxysms of coughing every few seconds. In the end, I had to just hold my mouth shut and just cough internally. because it was tearing my lungs apart. It's a cough that comes from down here. It's not a light cough. It's really a hacking cough.
Right.
I call it my graveyard cough. You see, it's very difficult for me, and I don't really expect you to believe this, but the work I'm engaged in, there's a lot of occupational hazard.
What is it you do?
I'm working in a healing ministry, it's Christian healing ministry, and of course it overlaps a bit with what we call the deliverance ministry.
People will go off on tangents often when they're talking about their problems, and actually it's not really, not all of it is very relevant to that particular problem. Although they may think it is very relevant, it doesn't help us diagnose, make a diagnostic decision really about what the problem is.
When you go into the enemy's territory, he doesn't like it. And the devil is extremely clever at coming in under disguise. I mean, this morning, I just suddenly felt so ill. And then I thought, oh, this is just his back to his tricks again. And I find that it's what I call an attack from the other side. It's not a genuine thing.
Right, well, with regards to your cough, I'm just wondering what the next step should be. I didn't really address it. It was one of those moments where you just think, well, that's a bit, I don't know where I'm going to go with that. Sometimes one of the medications can cause your ankles to swell,
yes,
and one of them can cause a cough, so I'm a bit reluctant to increase any unless we need to.
Yeah.
Now, I think the sensible thing would be to check your blood pressure again in a couple of weeks, and then we can make a decision.
Yeah.
Okay.
Well, thank you very much.
Good morning, Putney Mead. Rachel speaking.
My stomach's growling already. It just went... Can you get me some peanut biscuits and a packet of McCoys or something, please? Thanks. Bye.
Oh, is it one of your homemade concoctions?
Well, me and my mum made it.
Oh,
yes.
what's a big bit?
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. Yeah, well, yeah. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm sort of, I know my brain would just want to let me sleep, you know what I mean?
Okay.
I was sort of becoming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
I think I've got that. That is it.
My dad's a dentist, and he suggested maybe having metronidazole.
Okay. I think there's always a strong argument if things are improving to hold off. Metronidazole is not the nicest drug.
I actually wanted to see if I could get some amphetamines.
I wouldn't necessarily be happy to prescribe sort of amphetamines.
And how about steroid injections? Have you?
I want to do the hyaluronic acid or whatever it is that they're doing. That's what I want to do.
I appreciate if you can prescribe me with some diclofenac.
Okay. I'd probably just use paracetamol and ibuprofen.
I prefer not. Diclofenac is the best solution for me.
Take a seat.
Right. Yeah, the reason I come to see you is out of the blue, they stopped my climber valve.
Right.
Now, I knew nothing about it. Was stopped because I should have seen someone in March. Nobody told me I should see someone in March with this electronic stuff. How do you know?
But the pharmacist should be relaying anything that we pass on, so that it's because it's a new thing. I think there will be some hiccups. So I'm really sorry if it hasn't worked out for you.
I've been attending this surgery more than time in my life, probably. And I just think it's rude, ignorant, thoughtless to actually stop something without even telling me.
It was stopped in June.
But you see, because I only take one every other day, Dr. Andrews, I wouldn't have ordered them since then.
That's absolutely fine. But as responsible prescribers, we have to know that you've understood the risks of being on HRT at this stage in your life, and we have to document that. So, you know, your risks far outweigh the benefits at this stage when you've been on it for this long, and that's what all the research is saying and continues to say. So I think it's really just so that we can be sure that you understand that staying on it increases your risk of breast cancer, increases your cardiac risk. There are other, you know, it does carry risks with it.
But so, I think it's up to me to weigh up the circumstances that I'm prepared to risk.
It is entirely up to you, and our job is to be absolutely certain that we just keep reminding you what those risks are, because that's what our job is. So it is entirely up to you. I entirely agree with you, but that's what that's about. That's what's happened. So
well, if I'm
I can
told,
reinstate it. Yeah. So I'm not going to put this in your Dosset box in that case.
Right.
But I'm going.
Oh, that's right.
Yeah, exactly.
Just leave it to me to order it. Excellent.
Good.
Anyway, lovely to have met you.
And you.
Dr.
I'm glad we
Andrews.
managed to sort that out this
Well, I am,
afternoon.
because I came in here absolutely. I had steam
dear.
coming out of my ears. I really did. And said that I was going to sit downstairs and sing "I Will Not Be Moved" until I saw somebody.
She means it.
Hello, Patty Leeds, Lorraine speaking. How can I help?
Hi there, are you okay?
My GP surgery doesn't do injections, they don't do blood tests, so actually this is an exceptional practice, to be honest.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, yeah. I suppose, yeah.
And any thoughts of cutting back on your alcohol or getting a bit more help with it? Or does your outreach worker help you with that?
Yeah, well, it is from a drug and alcohol organisation, yeah, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, do you think you can do it? Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him, actually.
Okay, no problem.
I can speak to him, actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh, yeah, okay.
Yeah, I'm here now. Right. There you go.
Hi, is that Charlie?
It is Charlie, yeah.
Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah, cheers, Charlie. Bye.
Bye.
Is it all right if I talk to Charlie about it?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right?
Okay.
And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
I know where you're coming from. Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
Lady needs an urgent appointment, so I'm going to put her on now.
Doctor, just do me a favour. Can you put your finger up my bum, see if I've got a lot of poo up there?
Well, I think it'd be helpful, actually. Yeah, let's do that. Just relax, Teresa. Well done. Sorry. Well done. Good.
Good boy.
We'll talk about it in a sec. So get yourself dressed first, and then we'll have a chat
Is my
about it.
bum sore?
Doesn't look too bad, actually.
Have I got poo up there?
No, nothing that I can feel in your bottom, but it doesn't mean it isn't higher up in your tummy. So I'm just going to have a look at the computer to see if we had that X-ray of your tummy, all right?
All right, love.
Yeah, so hold on a sec. No. You do have to go to Queen Mary's for your X-ray of your tummy.
For my tummy?
Because an X-ray can help us when we're wondering if there's lots of poo in your tummy.
Yeah.
I think that'll be a helpful thing, because I'm trying to get a reason why sometimes you're having these runny tummies, really.
Yeah.
Is that all right if we get that done?
All right, love.
Okay. So get them to make the appointment for the blood test and for that thing.
Oh,
Okay.
thank you, doctor.
That's the blowing test. There you go.
Oh, thank you, doctor.
And do you, what soap do you use?
Well, I use body wash, my darling.
Because I think your soap maybe dries your skin out a bit.
If it gets bad, I'll have to come to you.
Okay.
Yeah. I like your jacket, by the way.
Thank you very much.
It's nice, isn't it?
Richard, leave Dr. Ernest's flowers alone.
Okay. All right then. I'll see you soon.
All right, doctor. See
Take
ya.
care, Richard.
Bye.
Bye-bye.
When I grow up, I will be a doctor.
Do you?
Yeah.
Oh, it's a very interesting job. You get to meet lots of lovely people. Oh, oh.
Warm this up, shall we?
Hello.
Oh, you're quite heavy. If you open up nice and wide for me and say ah. Say ah.
Hello, sweetie.
Is it a bit tickly?
Yeah.
Is that a bit tickly?
Yeah.
Come in. Hello, Mr. Hi. Hi, come on in. Hi there. Come on in. Right. How can I help?
It's just sometimes I get palpitations and I get the odd dull pain in my arm.
Can you describe it?
Just like a dull ache, really.
Look at that helicopter.
It's like a headache feeling, but except in your arm.
And how long would it last for? Is it all there all
A few
day?
seconds.
A few seconds.
A couple of minutes.
Couple of minutes, okay. And what are you doing normally when it comes on?
Right, can you and let me talk to the doctor? I just ignore it. Just getting on with things.
Okay.
Ashley, please.
Ashley.
Ashley, right. You've been warned so many times now.
Probably you
Right,
should
now,
maybe
come and
not
sit
touch
down here now.
Thank you. Sorry, so...
I was recently diagnosed with a hiatus hernia that came up in a chest x-ray.
Mum, I think there's going to be a storm coming.
I can't concentrate. Please, can you be quiet?
Look, I think there's going to be a storm
No.
coming.
Probably right.
It's not. It's going to be sunny until Saturday. Right, can you stop?
There's lots going on, isn't there? How are you managing?
It's tough, but I manage.
Managing.
I've got gallstones, as you know.
Yeah.
I've had a history of gallstones.
Right.
And I've also had a history of heartburn.
So, and what was it
indigestion.
If you've had this as the same pain for some time, what was it that made you call up today specifically about this pain?
Because I keep feeling lightheaded.
When did that start?
Just this week.
All right. Has anything else changed recently?
No. Ashley, please.
Some consultations are completely chaotic. And that can be because of the GP, the things that the GP is dealing with, or the chaos of the patient's living. And you can literally see it playing out in front of your eyes in the room. It's quite difficult to keep focused. And I'm always worried that I would miss something. And that's often where the discomfort is for me. I actually think it might not be a bad idea to get some tests done to rule out the heart as a cause of this, okay? And actually, probably the best way to do it would be through the hospital for the cardiologists.
I'm okay, yeah.
All right, so you'll hear from them.
On there, yeah.
Blood pressure and the pumps.
Brilliant. Thank
All
you
right.
very much.
Look at me. Look at me.
So I think I do keep my cool, but I worry that I've missed something. As people walk out and as the chaos leaves, I'm always left thinking, you know, what have I just missed? There's something else there.
Hello. Is it Mr. Morris?
Yes.
Hello, I'm Dr. Ernie.
Yes, good morning. I usually see Dr. Andrews,
Yes,
a
I
good
saw
relationship, but this is a man thing.
Okay.
It's not a matter of embarrassment, it's just that
Yeah, that's fine.
she doesn't have a penis. You do.
Okay.
I just need to have my testicles checked. They feel swollen.
Okay.
They feel heavy. So I noticed it 2 or 3 weeks ago during warm nights when I sleep naked. When I swing over, they sort of go clump.
Okay.
You know.
Yeah.
There's a slight pain at the root, as though being pulled.
2 or 3 weeks you've noticed this?
2 or 3 weeks ago, or just realising, you know, it's a warm night, but penis, as you know, gets very floppy, but it felt more floppy than usual.
You've also written on here low libido.
Yeah, I'm just turned 75. I've not had a sexual relationship for years, so if I do masturbate, it takes some time to get anything more than a...
Really? Okay. Yeah.
I mean, I've been giving it more attention because of this. So.
Yeah, no, of course then. Have a seat up on the couch.
What's your date of birth?
You're very welcome. Take care.
And the name?
Archie. Oh, I love that name, Archie. Hello. Could I have an appointment, please? I'm sorry, he probably doesn't sound anything like that. No, he doesn't. He's only born in 2003. Hello, it's Archie.
How are you getting on?
Since I last time saw you, I'm out of tablets for blood pressure.
When did you run out of tablets?
About a couple of weeks ago. I've been a bad boy for the last 2 weeks.
Yeah, well. So, and how are you feeling in yourself?
I think so. I'm feeling much better.
Are you?
I'm feeling much better.
How are the stresses? Do you remember last time you were going through a lot of stress?
Comes and goes, you know. I think it's my nature. I can't let go things quickly. I want everything perfect in my life, you know, especially in the business, you know.
Okay.
So if something is off a little bit, I get very uptight.
Right.
With my staff and all that.
Okay.
And lots of my friends have said to me, Ash, you need to chill out.
I mean, we had this chat before.
Yeah.
You're putting yourself at a very high risk.
Yeah.
I'm being serious because actually we're not talking about 10, 15 years down the line. If you carry on like this with these readings, blood pressure, with that lifestyle, heart attacks and strokes are a very real possibility for you.
Pinch your nose and blow. Keep blowing. Keep going. Keep going. Keep going.
I had something that was similar to asthma.
I always have been suffering of coughing.
Are you bringing up any phlegm?
A what?
The muscles that line the passageways of the lungs, they tighten up.
We need to try and get the asthma under control because at the moment it's not ideal.
Oh, you are wheezy. Got a little orchestra going on in there.
How will your wife manage if you have a stroke?
Difficult. I've seen people with stroke, and I have an uncle had a stroke nearly three years now, and he's in a home care, and all his money, what he's earned, is going in, being looked after, can't move, can't talk.
Okay.
He's like a cabbage sort of thing. You know, I've seen a friend passing away, so I think...
So you've experienced it close up.
Experience, yeah.
And so I think we need to make some changes now, and I agree, and I would support you. We talked about work stress.
Work stress is the biggest problem, and then another one factor is my dad living with me, and it's getting a bit... I know he's 89 years old, it's my responsibility to look after him, but it's just getting sometimes a bit irritating, you know.
Okay.
Sometimes, you know, he makes a lot of mess in the kitchen, and when I see it, I said, what is this, Dad? Come on. Things I tell him, don't do it, just leave it there. He keeps on doing it and makes a mess. And that boils me up, you know.
I'm just wondering what might help you. What techniques could you try to stop yourself getting to the stage where you just boil over suddenly, going from nothing? You're not going to be able to change him.
No, there's no way I can change him, you know.
But we might be able to focus on how you change how things affect you.
Yeah, okay.
Because I think that's where we could start.
Okay.
You can't change him, but how do we change the impact on you?
Okay, all right.
So you're in the same situation, but you approach it differently.
Okay.
I mean, there are other options. We have other options. If you're getting very stressed with this issue, you know, we can always think about a few sessions of counselling where you can just explore this with somebody who's not related to your family, and you can really work through what options you have.
Okay.
And I think we need to do this together. So what tablets do you need today?
I need the whole, everything.
And then can you have a think over the next 2 weeks, between now and when we touch base, what else might help you to manage the stresses?
Okay.
You know, just have an ideal world. What would help you? What do you need to do? What do we need to focus on? We'll do the blood pressure, but what else might help you to focus on the stress?
Okay. All right.
Yeah?
Okay. All right.
Between us, I think we can then get there, because otherwise, all of the stuff I do is not going to be worth it if you're going to go off.
I understand that.
do
It's
that.
not. It works both ways.
Yeah. So if we're happy to do that.
Yeah.
Hello, Putney Mead, how can I help?
Do you want to go and take a seat on the first floor?
Mr. Ackerman.
Doctor, how are you?
Fine, thank you. Nice to see you.
Nice to see you.
Right. What can we do for you?
I've had an operation on my ear. He had to rebuild my eardrum.
Okay.
Completely. When I came out of hospital, it was brilliant. I was jumping up and down. I could hear with both ears. But I had an infection, and ever since then, it's been driving me insane. Doctor, I am having a hell of horrible time. And I get the most throbbing headache, the mother of all headaches, I kid you not. And it hurts. It really feels...
Is there pain in the ear?
Yeah, everywhere. I get it all over. All over. It makes like a bubble noise. Brr, brr. Do you know what I mean? It's driving me absolutely insane. I wish to God I'd never had the operation. I really do.
Right.
Now, the past couple of weeks, I've been losing my balance.
Right.
Nearly fell a couple of times. I'm a chef, you see. And I'll be honest with you, Dr. King, I'm very, very worried because I use twin fryers and the temperature is 190 degrees. And if I fall head first into one of them, it might as well serve me on a fish and chips as well, or whatever.
I'm just feeling for any lumps in your groin there. Okay. So I'm just going to check your penis as well as your testicles. All right. And where's this pulling discomfort that you get?
It's really at the root.
So I'll just examine your testicles, okay? Good, that's fine. Would you mind if I examined your prostate?
Yeah, what does that mean? Put your
So
finger on my bum.
Yeah,
Yes.
that's right. Is that okay?
Yeah.
So the way to do it is roll over and face the wall.
Yeah.
And well done. Deep breath. Oh, that's it. That's fine. Why don't you pull up your trousers and come and have a seat and we'll talk it all through. Let's have a look. That was in the past. Okay. Your testicles, from my point of view, feel normal.
Right.
And your prostate felt fine. Slightly enlarged, but a normal shape. And what's reassuring is
they feel normal.
They do, exactly. With testicular cancer, if it's causing a heaviness to the testicles, they do feel remarkably different actually from normal. They really feel very heavy from our point of view. So the fact that yours don't feel like that and they're a normal shape, no extra lumps, is very reassuring. In terms of the erection change and the low libido, it might be worth checking your prostate blood test, but also your testosterone. just to make sure there's no sign that either one of those is abnormal, just as a so that we're covering all the bases, really. Okay?
Yep.
All right.
Thank you very much.
Not at all. Nice to see you.
Stop me if it's sore when I'm doing this, okay?
Right.
It's still wet and red. And
Sorry?
It's still wet.
And red.
And red, and
Very red.
there's exudate covering it. We'll take a swab, but we also need to do something as well. We can't just leave it like that. Let me just touch this on the inside. Sorry if this is a little bit sore. Sorry. Sorry. Okay, all done.
Did you see a small little hole in there still, no?
I can't see the eardrum. It would be better to have you seen by the surgeon that did the operation, but it's not a complicated problem. It needs to be looked at, and it needs investigation. So I think that is probably the way to go. That we can get you seen in that clinic.
Can you give me tablets for it or anything to?
We can give you some tablet antibiotics.
Yeah, that'd be nice if I can hit it with that. So I'm amoxicillin, yeah? We'll hit it with that.
We'll try.
Yeah, no worries, Doc. You
No
guys
problem.
do a great job, so, you know.
All right.
Thank you for your time.
No problem.
Lovely to meet you.
And you. Wrong way.
Wow.
That way.
Do you know what Windsor discussing that? And do you know why? I think it's the chemist. Hello. Hi, can I pick up a prescription, please? Hello. Hello.
Hello. How are you doing?
Oh, well, not doing very well at all. Really, I'm getting out of breath. It's all seemed to have happened in the last month, really.
Just getting worse.
I'm not sleeping well. And in fact, Saturday night, I just couldn't breathe.
Have you seen the surgeons yet?
Well, they said my ventricle in the heart, sorry, was closing up slowly, and that was why they said I should go see about having something put in to widen it up again. And I assume that's causing all the shortness of breath suddenly, is it?
Yeah. Well, if they do surgery, they will probably try to do it as minimally invasive as possible. So they might do it by going in via the wrist or via the groin and trying to open up the valve that way.
Yeah. I mean, if I was going to go, fine.
Yeah.
But if I'm going to find I'm worse off,
Yeah.
you know,
There are some risks of people having a stroke and things like that during this type of procedure.
yes.
The worst case would be that you didn't make it through.
Yeah.
But I think if you do nothing, I think your symptoms are steadily becoming quite a lot worse, aren't they? I felt I needed to make him aware that, you know, his illness is a life-threatening condition, and the natural process of that condition will be that he will steadily deteriorate and eventually die, albeit in an unpredictable time frame.
What do you think? If I didn't have it done, probably what? I've got about a year?
I think that's notoriously such a difficult thing to be able to predict, I think.
Yeah. I mean, my main thing is not so much going, but I don't want to find I'm going to spend months almost like a vegetable.
Doctors most certainly should not always intervene to save a patient's life through treatment. It completely depends on the individual situation and the individual patient, of course. In medicine, we always try to do good and not do harm. And so in some cases, intervention can cause more harm than good. And if they choose to decline a treatment, then you have to respect their wishes and respect that that's their choice. I think we just need to really await this appointment with the cardiothoracic surgeon.
Yeah, and if anything, obviously, it suddenly gets worse, I suppose.
If things become, very critical and that overnight, then, 111, or if you feel it's a real dire emergency, then 999.
Yeah.
Okay.
Yes. Okay. Nothing I can do about it, is there?
When the time comes, whether I will have intervention or not. I think it is it very much depends on the situation, and I think until that time comes, I can't probably easily predict my decision, but within reason, I'm sure I would mostly want something done, if at all possible.
Ah,
All right.
Okay. Thanks for your help.
You're welcome. Take care.
What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly
Is it?
painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
Many years ago.
right?
Yeah.
And you're fit and well otherwise.
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to Italy.
Oh yeah. Okay. I'm just going to... Just tell me to stop if it's too tender. I'm just going to put a finger inside. There's a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes.
Right.
When they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed up and decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, if for want of a better word, that runs at St George's, but it's on a Thursday, as far as I remember.
I'll be gone.
You'll be gone.
Yeah. Yeah, I'm going to, we're going to southern Italy, Bari. Do you know it?
I don't know. Sounds nice then.
And whilst we're there, I'm proposing. So, we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a...
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach and then just go down on one knee as the sun's coming down, and if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories.
Yep.
And some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep, thank
well,
you.
I hope it settles down.
Okay,
all right.
wonderful. Okay.
Bye now.
Have a good day.
And you.
There was this
Can't be
woman
bothered.
came in and she wanted to register her unborn child. And I was like, well, if it's not actually like on the earth yet, I can't like register it. And I was like, wait till it comes, you know?
Come in. Come and have a seat. Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
because
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
Yeah.
it's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there. Oh, you see.
Let me know if I hurt you.
Ow.
You won't enjoy this too much.
Oh, sorry.
Oh, that's dear me, dear me.
I had the constant pain in this area.
The pain goes from side to side.
Oh, blimey. I feel so ill.
Oof. It's a cyst. I won't do any more.
Pain is bad. I'm in a lot of pain.
I can see that.
Oh.
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across here.
Pain at the front.
Yeah.
It's difficult for me to sleep in and everything. Oh. And then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh, see, it's only that I sort of pulled myself up and
it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital. It's it's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because, unfortunately, she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some help. At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, not.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement?
Got it. There we go. Okay. See you later. Okay, see you later. I'm really proud to be part of the NHS. It's the largest publicly funded health service in the world. And it means that everybody, regardless of wealth and income, has access to good health care.
Gracias.
Thank you. Bye. Bye.
People often ask me, well, what is it to be British? And I think the NHS is a fundamental part of what it is to be British, and something that I'm very proud of, and I think we should all be proud of.
Draco speaking, how can I help?
I woke up and I've got a big old cough and I see a load of blood coming up. Like, you know, you have like mucus and stuff. Yeah, it was like that, but it was blood.
How much tea and coffee do you drink?
Oh my God, I drink 20 cups of tea a day.
Can you see that this will lead to a slimmer, fitter you?
Well, I don't want to be dead in 5 years, put it that way.
That's a powerful motivator.
I've never ate a lot of rubbish. I don't know, I mean, I eat meat, I eat vegetables, as you do.
Something's been going on for about 5 years that nobody can find out what's wrong.
Sometimes in medicine we have to put our hands up and say we can't understand what's happening.
To be honest, I don't want to smoke anymore. I definitely want to give up before the wedding. I love you.
Linda, kill that fly. I'm scared of flies. That fly there. I don't like them.
Thelma thoughts, please. Okay, hi, have a seat. Okay, how can I help?
Right. I look well, but I'm not well. Because been having this sinus problem for years.
Okay.
And it keeps going on and off, on and off. 2 weeks ago, I was driving. I had a lot of pressure here. And I felt really strange, felt really weird. And so I pulled over and I called the ambulance. And at one point, I couldn't see properly. I don't know what it was, but it felt like it was here. Even when I'm trying to talk, I couldn't even form my words properly. So they said maybe I had a mini stroke. Or something like that. And then it happened to me again.
Did you have a headache?
Yes.
At the same
I had
time?
a really bad headache while I was driving, and it started getting worse. And then the lights were really bugging me.
Right.
So I am a bit worried.
Hi, Daniela. How are you? Just take a seat. Hello, Dad. Let's take a seat. How can I help?
She have a problem with the lips.
Yes, I see.
It's been maybe 3 weeks.
Are they sore?
Yeah.
And do you have it mainly in these parts of the lips or the corners? Which is worse? Around there? Yeah, do you too? Yeah. Do you do much smacking of the lips? Which is like doing that. It's usually a habit children get into, even adults sometimes you see them, adults with it, and they smack their lips, and that causes irritation and inflammation. This is a perioral dermatitis.
Yeah.
It's an inflammation of the skin around the mouth. The key thing to do is to keep your lips fairly well moisturised at all times, even at school. And do you like school?
Yes.
Yeah. Are you kind of top in your class, or are you pretty near it, or?
I'm near the top in maths.
Are you really? Good for you. And so what do you want to do when you grow up? Do you have any idea? Have you decided?
I might be a teacher, a math teacher.
Good teachers, so important, as you'll know. Yeah. Okay, so we'll give you some treatment for that. This is a cream, and it's antifungal. And then this one is a steroid cream, and you need to apply it to the corners of the mouth and the pink area and the lips. The lips, yeah. So hopefully that will sort it. But I think the key thing is avoid lip smacking. Just leave your lips alone, basically. Okay. Good. Yeah. Nice to see you.
Okay. Thank you, Doc.
Yeah, you're welcome. All the best. Keep up your good work at school.
Yeah. Thank you.
Very important. Bye.
Yeah. Bye. Bye.
So there seem to be two separate issues here. You've got this background sinusitis that keeps coming, and then you've now developed this headache, which with visual symptoms. And I can't help thinking that could be migraine.
Yes, it may, because I've had migraines in the past.
Yeah, and this could be just another level.
Yes, this could be another level, and because of the nature of the work that I do a lot of driving during the day because I don't teach in a classroom. I go around to students.
What do you teach?
I teach every bloody thing. I teach math. Well, maths is my main. But I have to teach the child everything.
So you do like a home school?
A home school or wherever you can find to go and teach them.
Multi-talented.
Yeah.
What level do you teach?
Secondary school kids.
Oh, wow.
Yeah. So that's put a lot of pressure. And I have a headache every single day.
It's quite bright in here, so I'll dim the light. I'll turn the light off. So if you look at the wall straight ahead, I'm just going to shine the light once again. Does the light bother you?
Just the right one.
The right one,
Yeah.
OK. Have you been to the optician in the last year?
Yeah, I just got my glasses.
Okay, good. I'll put the light back on. Right. So having examined you, I can't find any kind of true signs, which is what you said when you first walked in. You said, look, everyone thinks I look well.
Yeah.
But I think because it's been grumbling and you've presented a few times, it wouldn't be a bad thing if I refer you to ENT from the sinus point of view.
Okay.
But if we go back to the incidents when you were driving, the way you described the headache on one side and then the visual symptoms, as soon as the onset of a headache comes, take an ibuprofen early, 400 milligrams, because it may just dissipate the headache quickly.
Thank you very much.
Good luck. Take care.
I'm constipated.
Right, okay.
You know, if you look, it looks like I'm pregnant.
Have you been taking antibiotics?
Supposedly microlite. It's not working.
Well, I'll get the doctor to ring you.
Okay, then.
All right. So I'll just spell that. Suppositories. Do you know what that is?
Jesus, Keza.
What is it? Suppositories.
I love you so much.
What's the problem today, Caroline?
There's something in my throat.
Okay, what's the problem in
I
your
don't
throat?
know. I've had it before where my voice distorts. I can't sing Happy Birthday. I can just talk quietly. If I were to sing, do, re, la, I get to one that goes, and it all goes stupid. No voice comes out.
Okay.
It's all distorted.
Okay.
I get severely out of breath. And I'm getting palpitations all the time. And I'm a bit worried about myself. And I've had this before, and they said...
What, the throat?
Yeah, and they cut it open, and then they took out nodules, they said.
Where did you have that done? Which hospital?
X.
Okay. So you felt your voice kind of go funny and referred to specialist, and then the specialist removed them via surgery. Oh no, don't cry, Caroline. Don't get upset. Let me get you a tissue.
I'm really scared.
Don't get upset. Yeah. Don't cry. I don't want you to get upset. I mean, it's good that you've come in, okay?
I can't answer all these questions, I don't know.
No, take your time. How long do you feel, honestly, it's been going on for now?
About 6 months.
6 months.
I keep really up with palpitations and everything. I'm going to die, aren't I?
No.
You can hear it. It's going in.
Don't get upset. I don't want you to get upset, okay? I'm glad you've come in and there is things we can do about it. Obviously, it's upsetting you. What do you think is causing it?
I don't know.
Is it something you're worried about? Because obviously you're really upset.
I am, yeah.
What thoughts going in your head?
I'm going to die.
Any coughing with this?
Coffee?
Cough.
No, the coffee is not sometimes.
No.
You just sit there, it's only Claudette with my coffee. Thank you. Please don't tell me what your tea bag's like.
I've stopped taking sugar in coffee and tea, which is a struggle because coffee and tea at work is terrible.
Tea. Have you had any tea?
I'm actually okay for now.
Okay, right. Are you sure you don't want any tea?
Yeah,
Okay.
sure. Thank you very much.
Yeah.
Is tea all right?
How many cups do you have?
1, 2, 3, 4, 5, 6,
Oh, that's quite a lot.
8 to 10 cups a day.
Quite a lot.
I think I need a cup of tea. Do you want a cup of tea?
Yeah, let's go and get one. I'll go and get my cup.
I haven't drunk my coffee.
When someone has nodules, they're more likely to have the nodules regrow, okay? And nodules can...
might be then.
Yeah, so people that suffer with things like nodules on the voice box, they can be either benign or something more sinister, you know, like things like cancer, but we've got to make sure it's not that. So we've got to refer you to the specialist either way.
Okay.
So let's do your blood pressure and temperature and things. Let's do your oxygen first. Are you able to swallow your food okay? Doesn't get stuck?
No problem.
Doesn't get stuck? No. Perfect. Any weight loss at all? No, so no dramatic weight loss. Open your mouth for me really wide. Okay. That's fine. So, Marilyn, I'm going to get that referral sorted out for you today, okay? And,
What about this breathlessness and these palpitations? What's all that?
Do you smoke at all?
I used to smoke about 40, 50 a day, but I don't. I smoke about 10 a day now.
Well done for cutting down, that's good. But with the palpitations, do they happen when you're just sitting at night resting or watching TV, or is it more when you're walking around, when you're just sitting resting? Okay. They sound benign and harmless. How much tea and coffee do you drink?
Oh, my God. I drink 20 cups of tea a day, Mum, plus.
20?
Yeah, easily.
You do need to cut this back, Caroline, because that caffeine with the nicotine from the smoking and the 20 cups of tea, that's a lot. So cut that down and book an appointment. Can you book an appointment in the next 1 week?
Tea to stop me eating and stop me smoking. Drink tea, drink tea, drink tea.
No, that 20 is quite a lot. So I need you to book an appointment this week to see one of the doctors and come in and talk about your palpitations. We'll probably get an ECG of your heart done, all right? And get a monitor just to make sure nothing's going on. All right? Nice to meet you, Caroline.
Nice to meet you.
Pop your bits on. It's quite cold out there.
When you were walking, though, it's warm. Thank you very much.
Take care.
Thank you.
Bye.
Hello there, how can I help?
Somebody lost the wallet.
Oh, I think that might be the gentleman that's just gone. Okay. That is the guy that's just gone, yeah.
Do you know where he went?
Out the door. Thank you so much for that. How can I help?
I've got appointment at 3 with Dr. Javed.
Lovely. Just take a seat downstairs, okay?
Just here, yeah?
Yes, please. Thank you.
What was that guy doing? Health check.
Of course. Hello, it's Ryan calling from Farnham Road Surgery. It appears that you've dropped your wallet and we've got it here in reception. Yeah, that's absolutely fine. Thank you. He's coming back.
Come and have a seat down there. This is Sheila, who's helping us out today. Did I see this with Dr. Sadiq, I think? Or he was telling me about it?
Yeah, he was telling me about it.
So there's one on the back, is that right? Can I have a look?
Yes, you can.
That's quite a big lesion, isn't it?
This, well, I was born with this. It was very, very little.
How long has it taken to get this big? Is it very quickly or a long period of time?
Well, a long time, actually.
What problem does it cause you? Is it catching on things?
For example, with belt or something.
Yeah.
It's just pain, big pain.
Okay.
And time to time, it's coming off.
Okay. It's like crumbles.
Yeah.
So I think we can do that today. That shouldn't be a problem. It's basically growing like this. It grows on the surface of the skin like that. So what we do is we put local anaesthetic with an injection, so that goes all the way here, so that you can't feel anything after that. And then we slice it off at the base with a blade, yeah? We send everything off to the lab, so they'll look at it under the microscope and just make sure that it's nothing to worry about, okay? So we can do that today if you're happy with that.
Yeah. Okay. What about this one?
So what problems does that cause you?
That one was bleeding like when I was here, 3 weeks ago.
Okay. Have you had it a long time as well?
Yeah.
In minor surgery in the NHS, we only really remove lesions that are causing symptoms, so crusting or bleeding or itching. We don't tend to remove things that are cosmetic, which would need to be done within the private sector, usually by a plastic surgeon. And if we were worried at all that there was any chance of this being cancerous, then we wouldn't do it in the surgery. We'd refer those patients off to the hospital urgently. So yes, but can I get you back in on another day? Remind me at the end and I'll send a message for them to give you another appointment for it. Okay, so if you want to come down there, I think we'll get you lying on your front if that's comfortable.
Okay.
Do you know what? Because it's very wide, it might be better to do it a slightly different way.
Okay.
Where we actually cut around it
Yeah.
and take the whole piece of skin out and then put stitches.
Okay.
The problem with doing that is that takes a lot longer than I have time for today.
All right.
But I think it's a better way to do it. Because it's quite big, it will leave you with like a shallow base bit of skin. If it's small like this, it's fine, it will heal very quickly.
Yeah.
But I'm worried that actually this could be at risk of not healing properly or getting
All right,
infected.
yeah.
So actually, what we might do instead is do that one now.
Okay.
Because actually this one I think will be small enough to do.
Yeah.
Yeah, I think this one is going to be better to do.
Okay.
So I'm going to get you instead to sit on the sofa that way, and then we'll do that, and then I'll rebook you for this one.
Okay, lovely. Thank you.
Come in and take a seat. You've got a bad back, is that right?
I've had a pain in my back.
Yep, okay.
Right hand side.
Yep.
Something's been going on for about 5 years that nobody can find out what's wrong. So I went to do Pilates.
Mm-hmm.
After a few weeks, I started to feel unwell, so I stopped going.
Mm-hmm.
If I did something sort of quite energetic, like change a car wheel, move furniture,
Mm-hmm.
afterwards I felt unwell. There were some occasions when I was sat at a table for an hour or so with my back pressed against the chair.
Mm.
When I got up, I felt unwell. I laid on my back to watch television for an hour or so.
Mm.
When I got up, I felt unwell. There seems to be a connection between something going on here that's making me feel unwell.
I can understand why nobody's found the cause, because that's really an
Yeah.
unusual finding.
I mean, I don't know what you've got in your back apart from muscle just there.
Yeah, well, you've got kidneys there, but I think you've had an ultrasound already, haven't you?
The kidneys were fine.
Yeah, and you've had blood tests and ultrasound that shows all
Yeah.
the kidneys.
Yeah.
There's not a lot of other organs that would have sensation that radiates to the back outside of that. Sometimes gallbladder does, but the gallbladder would have been picked up on your ultrasound when they had the kidneys looked at.
Yeah.
The problem is that if we send you to the orthopaedic people who will look at sort of all the muscles in the back, they'll send you to physiotherapy probably. But I don't think that physio is going to make much difference to the symptoms that you're getting as far as the nausea and everything goes.
I mean, I dance, I jive,
Mm.
so I'm doing this all evening,
And that's okay.
and it's no problem.
Okay. What I'm going to do then, I think we've got to attack it from a slightly different way. I'm going to refer you to the gastroenterologists and ask them to see you from the nausea side of things.
Okay.
Okay.
All these symptoms seem to tie in with the same problem that nobody can identify.
Sometimes in medicine we have to put our hands up and say we can't understand what's happening. But we've got to try something.
Thank you very much.
Good luck to you.
Thank you very much.
Okay, mate.
I'll get 3 prescriptions now, I'm told. I'm 60, is that right?
Even better. Yeah, I think so, yeah.
Somebody told me that. I don't look 60.
Yeah, they may ask for proof.
So this is going to be the local anaesthetic bit, so you're going to feel this going in a little bit.
Right.
And then after that's done, you won't be able to feel anything sharp, but you'll feel this bit as it goes in, okay?
Okay.
So just need you to stay nice and still for me, okay? Do you feel the needle going in now? Sorry, I know it stings a bit.
You all right?
Okay, that's the worst of it. You okay? Are you feeling a bit faint?
A little bit.
Okay, should we put the head down a bit?
Just going to lie you down a bit.
Do you want to open the window a bit? I want you to still talk to me, okay?
Yeah.
Yeah? You still with me? What are your plans for today? Where are you going after this?
I need to pick up my kids.
Oh, really?
Yeah.
They're going to wonder what's happened to your lip.
Mm-hmm.
Just going to a little bit of a clean, okay? So if you just keep your mouth closed for me, because there's a little bit of blood there, okay? Just keep your mouth.
You going to sleep?
No.
So I'm going to use you as a bit of a table, if that's okay. Okay, so I just want you to stay nice and still for me, okay?
Mm-hmm.
Doing minor surgery procedures on places such as the face is not too difficult in primary care because we tend to do quite simple procedures the way we know what the outcome's going to be in terms of scarring. GPs can do minor surgery after they've undertaken a certificate from the Royal College of General Practitioners. Personally, I ended up having a plastic surgeon come to supervise me a few times after I'd done the initial certificate, just to make sure that I was up to scratch.
You all right?
Mm-hmm.
Almost done. I almost felt like a dentist. Can I leave the dressing over the top of that to you? I
Yes.
think you do a better job of it than me.
Yep, that's fine. Okay. How you feeling?
Better now.
Good. Okay, get up slowly. Take a seat.
Okay. So basically, you have to keep this like this for 2 days.
For 2 days,
Yes.
okay.
After 2 days, you can take it off, and it'll be just like a shaving cut, and then you can carry on as normal.
Mm-hmm.
Okay?
Okay.
Okay, good.
Lovely.
Take care.
Thank you very much. Do I look funny?
Yeah. Only for a couple of days, though. That's okay. Take care.
Okay, thank you very much.
Bye.
Bye.
You look very smart, don't you? Have you been to school today?
So yes.
Have you just started school?
So, Marcus, what are you doing today then? What's the plan?
Going to school.
No. My plan is playing my Xbox.
Play your Xbox.
Have you been eating lots and lots of your favourite things?
Yeah, like carrots at school.
That's very good.
I would keep off school for a few days.
See that couple of days off then. Thank you, see that couple of days.
Good girl. High five. Good girl.
Thank you for waiting.
He's always had problem with his eyes.
Yes.
But obviously it's been a while he hasn't had it. And he just got up in the morning and it's all swollen up again.
Yes, okay. Let's have a look. When was the last time you suffered with this?
It's been a while now.
It's been a few years,
he
is it?
hasn't had it, yeah.
And when did the eye swelling occur again?
Yesterday when he came from school it was all swollen up.
Yeah, my
It was red and then it started swelling in the morning today.
No, my friend pushed me off it. My friend pushed me.
Your friend pushed you?
Yeah, from school.
Did he? What were you playing with your friend? Were you playing football?
I was playing football in school.
Who scores all the goals? Do you score all the goals?
I got 68 pounds in school.
Okay. All right. All right, Lena, why don't we just close your eyes? I'm just going to have a look there. Good boy. And open your eyes for me.
It's right over here.
Yes. Okay. This goes into your ear. Which ear should we use? Should we use that one?
For listening.
Yes, we're listening, yeah.
Thanks, sister.
Let's put that there. Good, temperature's perfect, okay.
I got 10.
You got 10?
The eyes are absolutely fine. There's no eye involvement at all. He does have the right eye, upper eyelid swelling, and there is some redness. It's also a little bit warm. Now, eye cleaning is essential. So what you do is you get hot water, use a flannel, compress it against the eyelid, try and do that for a few minutes, at least 4 times a day, okay? But in addition to that, what I'm going to do is I'm going to give him some antibiotics because it's red, because it's warm, because it's swollen. Okay. Back to school?
No.
No.
There you are.
Thank you.
Good stuff, all right, then, no worries.
So I need to stop.
Say bye-bye.
Bye-bye now.
Thanks.
Hi, there you go.
Thank you.
I tried chasing you, but you drive faster than I run. All right.
Have a nice day.
So, this cough of yours, tell me. Right, I've had it for about 2 weeks now. It's normal cold, as you just get normal cold, and I don't bother with doctors for that sort of thing, because I can just deal with it, innit? But then I started coughing, and I was looking at my hands, and I was getting, like, splats of blood on my hand, and I thought, what's this all about?
Dark or bright red? Or
Dark.
Like dark blood?
Yeah.
Okay. How's your breathing?
It's not bad, wheezy.
Okay.
It's cold, innit?
Have you ever had any asthma problems?
Nah, never.
What do you do work-wise and stuff?
Engineering, mechanical engineer.
So you're out and about?
Yeah, all the time. And obviously last night I woke up and done a big old cough and I see a load of blood coming out. I thought, nah, this is something a bit wrong here,
Proper, like, full on?
Yeah, like, you know, you have, like, mucus and stuff.
Yeah.
Yeah, it was like that, but it was blood.
Okay.
And it was proper thick, and I thought, nah, there's got to be something a bit wrong here.
Okay.
I've got this sweating problem.
Yeah.
Just ridiculous. I throw 12 darts and I'm starting to sweat. I walk from here across to the shops there, and I'm sweating. There's just no reason for it.
Yeah.
So you think you have excessive sweating issue?
I've always been a heavy sweater.
I know it looks like I've been running a marathon.
I'm still having problems sweating really,
Right,
because even though it's cold out there, I can't bear to put my coat on because I end up all hot and
Stop it.
sticky.
Oh, come on. My feet are sweating.
You must be melting.
I just can't bear this constant sweating anymore.
Oh, wow.
I've just had enough of it now.
you smoke? Yeah. How many? Not a lot. I don't know, that really... Yeah, that means, that means different things to different people. What does not a lot mean? I don't know, no more than 10. So, independent of all of this, I'd want to get you to stop smoking. Because yeah, of course. I know that's going to be one of the... You're young enough to not have this have an impact on you if you stop now, basically. Do you know what I mean? Whether it's related to what's going on at the moment, I'm not sure. So what I'm going to do is check your temperature, have a look at the throat, and have a listen to the chest, and we'll see what's what, yeah? OK, perfect. Cool. So... All right. Can I have a look at the throat? Would you say for me? Have a listen to your chest at the back, if that's OK. Well, actually, you might be able to get with just lifting it up. Yeah, that should be all right. Deep breath in and out through the mouth for me. OK, that's fine. And no, like, sweating at night or losing weight? Oh, yeah, I've been sweating a lot, to be fair, at night, yeah. Yeah? Like having to change your clothes, sweating? Or? Oh, not that drastic. Not that, OK. Losing weight or anything like that? No. So I think you might have a bit of a chest infection. I think what we'll do is get you on some antibiotics. OK, then. So I think your first instinct about this being, you know, the aggressive coughing is more likely, or it might be that it's actually a kind of a brown discharge from the infection that you've got rather than actual blood. Yeah. If you're still getting coughing with specks of blood afterwards and you need to come back, and then I think we'll arrange a chest X-ray if that's the case. Okay. And then obviously I want you to stop smoking. Yeah. All right. Thank you very much. No problem. Thank you. Take care, all right. See you too. Bye.
Can you book me an appointment for the 22nd to see the nurse? I have to have a special injection.
The only thing is, the treatment room clinics aren't actually on for that week.
Pardon?
The treatment room clinics, they haven't been put on the system at the moment, so I can't book that appointment for the 22nd.
I've got a card with it on off.
No, I believe you. It's just because the nurses haven't put the clinics on.
No, that's not right. Oh, would that be it? Yeah, she's booked me in for that date.
I would ring next week.
Pardon?
I would ring and book an appointment next week for it.
Yeah.
Because the nurses...
You'll ring me, ring...
If you ring next week, we'll book you an appointment for the 22nd.
Pardon?
Hi. Good.
Thank you very much.
Yeah, hello.
Hello.
How are you? Just take a seat. Oh. So you're on some treatment for your blood pressure that probably pushes your blood pressure down a bit too low. And I think that the medication you're on probably is a little bit excessive. And I think it would be worthwhile thinking about bringing some of it down again.
I would like to lose weight. If someone can give me something, a food suppressant or...
It doesn't work that way, though, does it?
No, all I'm saying is that I would love to lose weight.
Yeah.
And be more active.
Yeah, absolutely, yeah. And just see what your weight is compared to what it was, because I think that would make a big difference to your comfort and your fitness.
Probably say one at a time.
Good.
Virtually off the scales now.
About 149 kilos there. Good, you can just step down.
Well, that's the heaviest I've ever been.
Is it? Right, OK, yeah. And I mean, I look at things fairly simply in relation to weight. This is a set of sheets I put together for my patients because I think it's the most useful thing. Yeah. This is all food that's high in salt, so it holds on to fluid, makes you heavier because a litre of water weighs a kilogram. So avoid all these because then you'll lose the water. And your kidneys will be healthier. These fats and sugars are just mountains of calories.
And at the same time,
Do you need me? OK, yeah. I'll come back to you in a sec.
Yeah.
Yeah.
No cream, butter, cheese.
I advise people to avoid sugar because it puts a strain on the pancreas.
Sometimes I have a little bit of a treat. Last night, apple pie with custard.
Whatever I eat, it's got sugar in it.
It's difficult, isn't it?
It's very difficult.
There are some good sugars, mainly in fruit.
If we have a barbecue, we have a fruit salad.
Yeah.
Some fruits you should avoid eating too much of. Pineapple, mango, papaya, and eating lots of grapes.
I know you can't have things like grapefruit and things like that.
You can have them. You can have a few, as long as you don't have a whole bowl.
I once had a patient who ate a tray of peaches a day. Thought he was doing the right thing because there were peaches.
Do you like a lot of salt in your food?
Unfortunately, yes.
Have we tried to cut that down?
I haven't yet, no.
Unsaturated fats are generally healthy, and these are to be had in vegetable oils and in oily fish.
Do you not eat fish?
It's got batter on it.
No, no batter.
Saturated fats are harmful, and these are mainly fried food and animal fat.
Do you eat much fat at all?
When I can, yeah.
I would advise most people, including myself, to do their best to lose weight. You're lighter, you feel better, you'll be healthier.
No sweets, cakes, buns or pastries. Well, I don't have sweets. The others I do.
Well, no.
Well, yeah.
Sorry, you were just going to say something to me when Dr. Ahmed...
Now,
That was an age ago.
I'm sorry.
Bernie's right. I have forgotten what I was going to say to you.
If you stick to this fanatically, you'll absolutely lose weight. And the more weight you lose, the more exercise you'll be able to take. And then you get into a virtuous cycle.
That's what I was going to say to you.
What?
The more exercise I take with the diet, obviously it's beneficial.
It is.
So if I had a dog...
Oh, yeah.
If I had a dog...
Is this issue again? I've heard about this before. That's right, yeah.
And your little dog.
That's right. Well,
I
how determined are you going to be? Can you see that this will lead to a slimmer, fitter you?
I don't want to be dead in 5 years, put it that way.
That's another powerful motivator. Yeah, well, it's really nice to see you, John.
Andrew, thank you very much.
Yeah, you're welcome, yeah. All the best. Bye now.
My hair. I swear it's different water down here compared to up north.
Because I always notice a difference when I go away. My hair's always softer.
Yeah, my hair's softer when I go back up north. I'm like, ooh,
Is this water?
Yorkshire water.
How can I help?
I feel I need to have a hearing test.
Okay.
I'm not picking up subtle conversation. I'm with my colleagues at work. It's embarrassing that they're picking up things before me. They're getting customers before me.
Okay.
I'm just embarrassed by it.
What do you do at work?
It's ushering front of house in the arts exhibition centre.
Oh, right, okay.
And we used to just go around by ourselves. But now they've changed it. And so I've been noticing with other people.
And is it just conversational things? What about sort of TV, radio, that sort of thing? You know, do other people mention that you have the TV loud all the time?
Sometimes I have to hire it up with some talking.
Yeah, okay.
The telephone. I hear better in one ear than the other, but that has been for years because I had that ear drum damaged.
Okay.
But yeah, TV and conversation, and people talking, is where I notice it more. Yeah, and I just don't like it.
Yeah.
I don't want to have to be wearing hearing aids.
Yeah.
I hope it's not to that degree.
And it's on both sides, just to be clear.
Maybe this one is worse than this one.
All right, should we have a look?
Okay.
Okay. And what I'm going to do is just a very basic test. So just cover one of your ears. So just pinch back your ear like that. Okay. I'm going to make a noise. Okay, and I want you to compare on both sides. Can you hear that first of all?
Yeah.
Yeah. Now block the other one. And you can hear that?
It's louder than that one. I can hear it.
Yeah.
But
It seems loud on the left side.
Yeah.
Okay. Doesn't seem to be anything obviously abnormal about your eardrums, and the canals both look healthy, the ear canals. But I think in the first instance we should get some formal hearing tests done. So I can refer you to audiology, who do these tests, and then they can hopefully give some guidance on whether there is hearing loss on their measurements, and if there is, what type of hearing loss it is. Okay.
What type?
What type? There's a different type of hearing loss. Yeah. There are two types of hearing loss: sensory neural and conductive. Sensory neural hearing loss involves damage to either the tiny hearing cells that are on the inside of our ears, or even the nerve that transmits those signals from the ear to the brain. The other type is conductive, which involves blockage, either with wax or fluid from the buildup of infection, which prevents the transmission of sound. We're not talking immediately about hearing aids and things like that. I know you mentioned that's one of your worries. I think let's get the testing done first to kind of see where we're at.
Okay.
Yeah?
Right.
Okay.
Thank you.
No problem.
I've washed my hair and I condition it, I use oil, like ones with oils in. And then I put oil on my hair after I've straightened it and put a hat on for about 15 minutes. It makes it really soft and shiny because you get the heat with the oil.
When did this cough start?
About a week and a half ago. Yeah. But I wasn't having any tightness on my chest.
Mm-hmm.
But the last 2 days, it's just awful. If I get up, I'm...
Breathless?
Yeah.
Are you feeling tired or exhausted?
Yes.
So deep breath in and out. Yeah, certain bit of wheeze there, all right. Yeah, my. Lots of sounds there. We just need to slip this off and listen to the back of your chest. That's good. Big breath. And again. Yeah. Yeah, I can imagine that you must be quite wheezy. Have you got a brown inhaler? Are you taking Seretide?
I'm taking Seretide,
Yeah, Seretide. But at the moment you need an antibiotic and you need oral steroids. You do, yeah.
Something I'm very used to.
I know you are, absolutely, yeah. As you know, the whole aim in asthma management is to not need to use those more than twice a week. So if you need them more than twice a week, then you're obviously not on enough of the
Yeah, because I use these every day.
Do you? Yeah, indeed, yeah. The more Symbicort you use, the less salbutamol you use, the better your asthma will be managed. So we start you off on an antibiotic called clarithromycin, and then I'd like you to take the prednisolone, and you should be much better within 48 hours, etc. Yeah.
Brilliant, thank you.
You're not a smoker?
I am a smoker. Yeah, I'm actually trying to quit. To be honest, I don't want to smoke anymore. It costs me more to smoke. I could save all of that and go on holiday.
Oh, absolutely. And the cost is one thing, but of course the other is the health cost. Every single cigarette you smoke takes 11 minutes off the end of your life. And also, not only that, 80% of smokers die between 10 and 20 years earlier.
You get married?
It'll be 2-3 weeks now.
Oh, why did you do it?
Why did I get married?
Yeah, why did you do it?
On Saturday, we've got a family wedding to go to. She's not going to be dancing or anything, she's just going to be sitting down here.
She may want to start dancing, depending on how that feels.
So where's your sister getting married?
I have no idea.
My nan and granddad were married for like 47 years. Like, I couldn't imagine being with someone for that long. I'd want to kill him by the life.
You're trying to lose weight.
Get married on the 8th of October.
Fit into your morning suit.
A kilt. I'm wearing a kilt.
Are you wearing a kilt?
Yeah.
Oh, even better.
I've got Wednesday, Thursday and Friday off. It's my wedding anniversary.
Oh, lovely.
We go to Clifton, then we're staying the night there, and then we're having breakfast there.
Lovely.
Check me out.
Lovely.
Before you die, you get these conditions. So, lung cancer is probably the commonest, but COPD, chronic obstructive airways disease.
No, I just want to quit now.
Yeah, and the thing is, in some respects, it's amazing how well the body deals with it.
Yeah.
That it doesn't pack up a lot sooner. It's a miracle.
Yeah.
But on the other hand, the miracle doesn't last.
I definitely want to give up before the wedding.
Yeah, definitely.
Yeah. When is that?
We get married in June.
Lovely. Very good.
Yeah.
Excellent. Yeah,
Whatever we save can go towards a honeymoon.
Yeah.
Maldives.
Not that far, babe.
Okay.
We're going to Ireland.
Yeah, well, Ireland takes some beating. She could have Donegal.
We're going to Kiss a Rock.
Oh, and that's the Cashel or Blarney.
That's where we're going.
Excellent.
Going back to the roots.
Stay up.
I love you.
I love you too, babe.
How long have we been together?
Too long.
Many years.
So you should feel a good deal better within 48 hours. Once that's cleared up, make sure you've got your flu jab. The flu jab is probably the most important thing. Flu could be, potentially fatal for you. So it's really important to protect yourself against it.
Brilliant.
Good. Yeah, nice to see
Thank you very much.
Good evening, mate.
Yeah, and you. Yeah.
Thank you. Bye.
This was
what happens when you have a day's holiday. You end up running around trying to get things sorted out for your husband. That should be relaxing.
Women don't relax.
They don't. There's always something to do.
I'm always busy.
When he's not working, he doesn't like to be woken at 6:30.
Yeah.
But I'm off. Boy, that alarm's on for 6:30. I've got to get up whether I like it or not.
Yeah. Typical man.
Oh, bless him though. He's a sweet.
No.
I've been getting a lot of nosebleeds, Doctor, the last couple of days. I've been sitting down like that
Okay.
and just sneezing. All of a sudden, it's been
How long has that been going on for?
about 3 days now. Then it stops.
Yeah.
And another thing is the blood. How did it go?
The tests were fine, except you're short of iron. You're not anemic,
No.
but your iron levels are right at the bottom of normal. They're only just okay.
What does that mean? What's that mean?
What does that mean? Well, it either means that you're eating just enough iron, or you're using it up at a faster rate. Why would you be short of iron?
I don't know. I mean, I eat meat, I eat vegetables, as you do. I eat fruit, fish. I'm having fish today, husband, fish and chips. I don't eat a lot of spicy stuff because I'm very plain eater. I've never ate a lot of rubbish. I don't eat rubbish. Don't appeal to me.
And other than the sneezing and the blood coming out, are you bleeding from anywhere else that you know of?
No.
And you sneeze and then blood runs out
From this side.
from that one side.
Not pouring, like, you know, you sit there and it goes, it just comes down.
So not enough to have caused this thing.
No.
I'm intrigued as to why it's only just okay.
that either.
No. Okay, right. Should we have a look at your nose? Is that okay?
Yeah. It's this side.
Let's check this side here.
Yeah.
Yeah, you can see where it's coming from. So you've probably got a little infection in the skin there, and the skin's gone very thin. I can see the
Oh,
where
there's
the blood will come
infection
from.
in there.
Yeah.
How would that happen then?
Oh, so the bugs are just around everywhere. We just pick them up. Yeah. So I'll give you some antibiotic ointment to put up your nose
I see.
to try and
Just
treat that.
rub it in with the finger.
Yes.
It's a bit confusing, isn't it, about that iron? I'm a bit sort of upset about that.
Okay, don't worry about it.
No, I mean, I'm 70 now. Perhaps all my body's changing, you know?
It will do, but we still won't account for this, though.
They always put it down to your age, don't they? You say, oh, you're getting older now, Sylvia. It's all down to your age.
Let's repeat the blood test for the iron.
What's that, for the iron?
For the iron.
Right.
Yeah.
So apart from that, everything else is all right. Your cream for
So
me.
the cream for the nose. Okay. Now, I should say, if it doesn't get better, come back and see us.
Okay, then. Thank you
Okay,
very much.
Take care. Thanks for coming.
Thank you.
Bye-bye.
I will. Bye.
Bye-bye.
Bye.
Enjoy the rest of your holiday.
Thank you very much.
All right, take care.
Thank you very much.
No problem.
Have a lovely day.
And you, bye-bye.
Bye.
Managing how you choose to prescribe for any patient can sometimes be a challenge. If you have any sniff of getting a prescription from two doctors at the same time.
I promise you that's not going to happen. This is just a misunderstanding.
Promises don't cut it.
Patients who have a positive outlook on life are a pleasure to work with.
We have a laugh because just as they patch me up with one thing, I get something else. Always fancied a lobotomy.
Behave yourself.
I think it's quite difficult sometimes to realise that there is only a certain amount you can do.
And I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
Does it hurt you when you go to a wee, Charlie?
He goes
for a wee a hell of a lot. Why did you go to a wee so much?
Hey, Chris, how are you? Okay.
Farnham Surgery's been to Pam. How can I help?
Hello, it's Dr. Hyder. Come through and have a seat.
You all right?
Fine, thank you. And how can I help you today?
I had a really serious accident on a Thursday. I got my legs crushed.
Okay.
So...
At work or...?
At work, yeah.
Right, okay.
I was, hard to explain to everyone. I was sitting, it's not sitting down, but I was working with my legs in between two rollers and cargo systems. Somebody activated a lane and a pallet, my legs were sitting down like that, crushed my legs against the rollers. I can explain it to you. Let me just get out of there. So if I was, by the time the roller bed come, I was like that against the rollers.
Oh.
The pallets coming from behind and crushed my legs.
Right.
And literally.
It's me.
So yeah.
Yeah.
They would have been taken. It was 4 ton. So they would have taken them clean off.
Goodness me.
So it's a lot of it's psychological at the minute as well, because it's I get flashbacks and that. Scary. Obviously, I can't work at the minute.
You've got a lot of bruising there.
Yes,
as well.
it's coming out today.
And this cut as well.
No, this leg is actually not too bad.
But that happened at the accident.
Yeah, that's just pressure. I mean, I had an X-ray on Thursday.
you?
Yes.
Yeah.
And there's no broken bones, but she
Okay.
said there's a hell of a lot of swelling.
Is it painful on the shin?
The pain, that's not too bad to be fair, but it's when I walk around, it's more internal. So I started to pinpoint where it is. It's only when I put pressure on it and weight in it. I can sort of walk around all right, I just take that for support.
Yeah.
But I can't get upstairs properly. My job obviously involves me climbing up ladders, steps, because I'm a maintenance electrician. So...
Yeah, can you bend your knee okay?
Yeah.
So the knee bit's fine?
Knee bit's fine. I mean, here hurts. That really hurts there.
And the X-ray, there was definitely no fracture.
No fracture, no.
It's
You've got to
okay,
think,
then.
my legs must have squeezed to the side of my arms.
It's unpleasant, isn't
It
it?
is, yeah.
So you need a sick note. Do you need pain relief?
I probably would, yeah. And something, anti-inflammatories or something like that help?
Yeah, I think it's pretty extensive bruising, isn't it?
So
and
the bruise is
swelling.
coming out, so...
I think a couple of weeks would hopefully mean that the bruising will start to settle,
Yeah.
but soft tissue injuries, they can take up to 6 weeks to resolve
Really?
altogether. I've given you the cocodamol. You can take
Yeah.
a maximum of 2 tablets up to 4 times a day. And then that's your sick note as well. So I've just written crush injury to both legs at work.
Thank you.
And we've done it from the 22nd to the 8th.
Thank you.
So if you're no better by the 8th, then come back and we'll see you again. And if it's worse, we can always see you soon.
Yeah.
All right.
Cheers, thank you very
That's
much.
okay. Take care then.
Thank you, bye-bye.
Bye-bye.
I don't want to waste 4 hours at Wrexham Park, but at the moment I'm having severe facial problem and hitting my right arm, and I don't want to go to Wrexham because I'm one of those patients that has fibromyalgia type things. Okay. So is there somebody I can get checked before I go? Just a minute. This is not affecting my voice at the moment. It's affecting my lips, my tongue. Normally it just goes down here. It started with a headache, which I've still got, and it's going down the left side of my body, slowly but surely. Have you had this before? No, not like this. My daughter, she's trouble. Yeah, it's going slowly, it's affecting the nerves down the side of my body. I don't know, that's what I'm worried about.
A month ago and said I was having a stroke, and I was.
It won't surprise me.
Okay, thanks. If you take a seat for me, and I will just quickly speak to the doctor.
Okay.
Yeah, thank you. So it's not, yeah. Knock on his door.
Come in.
Hi.
Tell me.
She's, I don't know if she's having a heart attack, lady, but her whole left-hand side is going numb. She's got now a tingling in her tongue.
Let's get the ECG for her. Who's doing the merge treatment room?
Hello.
Alison, good afternoon. How are you today?
I'm good, thank you. How
are you?
I'm fine, but one of my patients could be having a heart attack. I want an ECG done.
Okay then.
She is Karen Price.
Okay.
And shall I send her towards you? No.
Yeah, straight down towards 10.
Yeah, I'll take her there.
Thank you.
Thank you.
Thank
Cheers.
you.
Bye.
When she's done with that,
Sorry?
when she's done,
She can come straight.
come here, yeah?
Yeah.
Okay, thank you.
I haven't had anything like this before.
Yeah. Your speech seemed to be okay.
My tongue's all
I had
tingled.
I mean, I know it's sort of the best thing to tell you, but I had a minor stroke a long time ago.
That's what I suspect this is.
10, 15 years ago. I didn't know what it was, but my face started drooping from one side. I was really stressed. That's what I had.
Could you follow me? You okay to get up? Yeah? Sure. Don't worry, you can go slowly.
So just follow my finger, okay?
Stick your tongue out and waggle it from side to side. That's fine.
Open your mouth, show me your teeth.
Sometimes I can smell burning when there's no burning.
Okay.
Are you checking that I've had a stroke or something?
Come in. Hello, come and have a seat.
There we go. Thank you.
How's it going?
Alright. I've been having headaches on and off for a little while.
Mm-hmm.
And today I had one at about 5 to 2.
Mm.
And as I was driving home, I got a pain down here. And it's now getting gradually worse. And my arm and leg don't feel...
Is it feeling very weak?
It's not so much weak as though it's not quite there.
Quite there. When you had previous heart attacks, what were the symptoms like? There was mainly chest pain, wasn't it?
Chest pain. This is nothing like...
ECG is absolutely normal,
that's what the nurse
which is good news in a way. Have you lost any power in your hands and legs, or it just feels like that?
It just feels they're lighter on this side.
Okay. Can I have a quick feel of what's going on? Examine you.
Yeah.
Try squeezing my fingers tight. Tight, 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 tight. Okay. In any urgent or emergency situation like this, it's important for a healthcare professional to be level-headed and calm, mainly because patients are in a state of anxiety. Okay. Push me away. Pull me towards you. Like this. Hold it like this. Push me towards you. That's good. Okay, I'm just going to quickly have a look at your eyes. Quite often, it's very easy to succumb to the pressures of the emergency and get the anxiety and the fear transferred onto you. And then the patients won't be reassured and they will lose the confidence in the healthcare professional. Hence, I was calm and level-headed. Close your eyes tight, 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 tight. Good. Clench your teeth for me. That's good. Oh, thank you. Sorry about that. So mainly at the moment, it's like headaches on the left side, tingling sensation, and feeling weak.
Yeah, I'm tired. It's like somebody's hit me with a baseball bat on the side of my face.
Thank you. Based on your symptoms and the scoring system, it would put you on some risk here. We need to exclude if there is any phenomenon like mini stroke. It might be worthwhile speaking to the High Wycombe Stroke Centre what they think we need to do. Is that okay?
Yeah.
Thank you for your call. We are experiencing a high volume of calls and all available operators are busy. Please hold and your call will be answered shortly.
Doesn't seem like we're having any luck today.
So if you are having a stroke then...
Well, if there are fast symptoms like complete weakness on one side, tingling, facial droopiness and everything, we advise patients to call 999. High Wycombe is the stroke center. That's where we get on-the-day investigations like MRI scan and everything. That probably is the way forward. As soon as they see this letter and everything, they'll be happy to see in High Wycombe anyway. Is that okay?
Yeah, yeah.
Shall I give that to you?
I'll take that. Thank you.
All the best. Hopefully it's all going to be okay, all right?
Okay.
Take care. Bye-bye.
I've got bloody animal fleas on me. Little tiny animal fleas. 2 of them just jumped on me. I don't know where they're from. Well, they're from somebody. You've got birds and squirrels and chipmunks. You're not enjoying any of it, no?
At the moment, I'm not. I can't. I just can't even get outside.
Charlie Williams, please. Hello there.
Hiya.
Come in. Sorry to keep you.
That's all right. Sit down.
Hello, Charlie. He's had some pain.
Yeah, lower abdomen,
Okay.
right in the middle. Now, he's had this a couple of times over the last month or so, but it's not been to the extent that it was this morning. It's coming again. He said the pain is always there, but it like spikes.
Yeah.
And then he's doubled over and it's like cramping and stabbing.
Yeah, okay. And when you do a wee, does it hurt you when you go to a wee, Charlie? When you do a wee?
No.
Doesn't sting. Good.
He goes for a wee a hell of a lot. Like, he'll go in the space of an hour about 5 times. I'm like, why do you go to the wee so much?
Sometimes boys, their bladders are slightly sort of weaker than women's, and you find that they tend to sort of go and they sort of go out of that. Now, if he's not getting any pain, it's unlikely to be an infection, but I think it's worth trying to get a urine sample at some point and bring it in so that we can test that. You haven't had any diarrhea when you've been to number 2?
I have had one.
That was a couple of weeks back.
Oh, a couple of weeks ago.
1 week ago.
1 week ago?
No, I think it was a couple
I had to have toast.
It hasn't been constipated. It's not been like when you go on lots of little hard things and difficult to get out.
No.
No. Can I have a look at you and your tummy up on the table? So we jump up? Let me get this for you. Good man.
That's a good
Lie down. Good. That's good. Just open wide for me.
It was really warm this morning, actually. I've given him some Nurofen.
Relax. Just check his temperature and open that up. Okay, that's fine. And then that way. 36.4, so that's okay. Let's have a little feel of this tummy. A wee bit sore down here. Sorry. Have you had lots of wind? You're a bit windy, aren't you?
Yeah.
Yeah. Come and sit up again now. He's obviously getting some crampy pain and the bowels are quite active.
Okay.
So it sounds a little bit more like he may be getting a little bit of a bowel infection and he may end up being a bit sick or get some diarrhea again with it. Sometimes very early things like appendicitis can present just with general tummy pain. And at the minute, there's no indication that that's what it is.
Good.
I would continue doing what you're doing, give him some Nurofen, a little bit of whatever he fancies to eat, and a little bit of fluid every so often.
Don't tell him that. I'll be asking me for ice cream for lunch.
Yeah, whatever, in a sense, whatever he'll take. If he's getting worse or going downhill, bring him back this afternoon so we can just do a double check and make sure it's not anything like appendicitis or anything. But if you can get a urine sample, it's worth just, if you do, dropping it in so we can just check.
Got a pot or anything?
Yeah.
Thank you.
What am I going to have to do?
Oh, lovely.
Okay, young man.
Say thank you to the doctor.
Thank you very much. Pleasure to meet you.
Okay.
Okay.
Brilliant. Thank you so much.
Okay, not at all.
Cheers.
Well done, well
Come on then at once. Look.
Sorry, doctor.
It's okay, Leslie. Come on in. Sorry, I'm running late. So, last time I spoke to you, I got you in to see Dr. Javed because you said your chest was worse, yeah?
What did they say you've got? What's your diagnosis?
Avian lung disease.
Hypersensitive to birds.
Well, they told me to get rid of my birds because I had about maybe 500, 600 different types of birds, which I can understand was giving me this problem.
They think that you've reacted to the birds and they think that there's damage in...
Well, the blood tests show that he reacted to the birds. I've seen it on the screen. He keeps saying it's not the birds, but...
What I mean is that they think
there's some damage to your lungs because of the exposure to the birds. Yeah. Okay. So we need some advice from the chest physicians about how we move it forward. So that's the one that we can't get you an appointment. So twice we've got them to rearrange it, and twice they've cancelled it. I can keep chasing.
I've told him that the doctor can only do what she can do.
Yeah. So what I can do is escalate it, and we've escalated it from this man's appointment was cancelled because of the doctor's strike and you haven't booked it, please book one, right the way through to an urgent referral being faxed.
Yeah. One of my main concerns at the moment is his
mood.
His depression. This man is getting more and more depressed every day. He's been my friend for a long, long time, over 13 years. He talks suicide, he talks all sorts of things, and I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
What am I going to do? I mean,
It's two things. Yeah, there's the depression because you're feeling so ill, and there's the fact that you're on a high dose of steroids, which will make you depressed. And every time we try and reduce your steroids, your chest flares up. If I could stop your steroids, that's what I'd do. But every time you try and drop them, you really struggle, don't you? We've spoken before about the fact that they won't constantly do scans and x-rays, but what they need to be doing is deciding what they need to do. Yeah? What I want them to do is tell me about your medication. Yeah, because I think that if we could change the sorts of steroids you're on or reduce the amount of steroids you're on, then I think that a lot of the other symptoms would improve.
But the trouble is, one of your biggest things is you do just need to. I know it's very hard, but you need to just relax about what's going on around you medically.
It's very hard
because
when
but everybody's doing the best that they can do.
Well, you know that, don't you?
It's very hard on your own because your head you start thinking the worst all the time. Your head, I seem to think the worst.
Well, that's been one of what they think you have would account for your symptoms. We're just really struggling to control them at the moment. From the point of view of chasing the chest physician, I will do it again.
Thank you very much, Doctor.
And I'll see you then.
No,
it's fine. It was nice to meet you, Pam.
I mean, he just gets very frustrated, and I mean, I know he's got all these things, but a lot of his things are exacerbated by anxiety. I know they are. Bye, nice to meet you.
Bye-bye.
How are you doing?
Yeah.
Let's take a seat. So, there's a few problems.
Yeah, I heard.
Yeah.
I've sorted it out. They were supposed to have a script for me just in case I didn't get what I got from you. And like I said to you, they only give you 5 minutes, and I said to them, yes, I got from Dr. O'Donnell, but you only gave me up until the day I got to him.
But the doctor says that...
I know, I chatted to the owner.
But you told them you hadn't seen a doctor here.
No, I told them I have.
2 weeks before this consultation, Yasser came back to the practice and saw me after an absence of 2.5 years. He told me that he had moved back into the area, and so this was the first time that I'd seen him. His problems are dependence on opiates and benzodiazepines. The reason he came to see me that particular day was for his prescription for diazepam. But he omitted to mention that he'd been to his previous GP 3 days before and had gotten a prescription.
She's trying to say, I've got a script from there and I've got a script from here. And I said, it's not right, it needs to be sorted out.
Why did you go back to Dedworth at all?
They rang me and said...
But you should say, I've moved to a different practice, I've read
I said that. I said, it was about the script.
Yeah.
They said to me, come get the script. And I said to him on the phone that I don't need it. I'm with Dr. O'Donnell, because she phoned me and said, no, you've got 2 scripts. And then I was like, what? And then I went there and then sorted it out. I took my dad with me because of proof. And then he went in and then he chatted as well and goes, look, my son didn't do that.
Well, it does look very suspicious. It damages trust.
Morning, ladies.
Morning.
I have an appointment, Walter Godley.
Take a seat next door. Take a seat next door.
Thank you.
Seeing lots of gentlemen today.
Sorry?
Seeing lots of gentlemen today, it's making a change.
So this is your third one?
I've switched off because of the children in there.
Yeah, it gets too much.
They're a bit noisy.
What do you want to see the nurse for?
Yes, because I can't hear.
You can't hear? Right.
How are you?
I can't hear a thing.
All I can hear is like a whining noise. Yeah.
It's Dr. Bajwala.
Is it a lady?
It's a man.
Yeah, man.
Right, how can I help you today?
I've lost my hearing in my right ear.
Right.
Part of my hearing in my right ear.
Sorry, what happened?
Sorry?
What happened?
Saturday or Sunday, I put my finger in my ear and a brown blob of wax came out of my ear. And then maybe Tuesday morning, the hearing sort of like went about 90%.
Okay.
Last night it just kept going and coming and going and coming.
Is there any discharge? Why you put your cottonol?
Not since the weekend.
Okay, so what's the reason you've had your cottonol still there?
The wife put some olive oil on last night.
Oh,
and said,
okay.
don't take it out.
You should never put the cottonol because it will absorb the oil. Okay, let's have a look. So have you taken any painkillers?
Sorry?
Have you taken any pain relief?
Yeah, I'll take some paracetamol. No, it didn't work.
Do you use earbuds?
Sorry?
Do you use earbuds to clean your ear?
I did try a weekend.
What, this year or that year?
That year.
Okay, so you never...
I've got no problem with that ear except for partial deafness anyway.
Yeah, because your ear looks a little bit perforated. Let's have a look here. Never use cotton buds.
Oh.
It looks a little bit infected as well. Okay, there is a little bit of infection there.
Oh.
Sorry. So what I'll do is I'll give you some ear drops. It looks a little bit infected.
Sorry?
There's an infection there
Yep.
in your ear. So I'm going to give you some antibiotic ear drops and some pain relief. I want you to come back and see us next week, Monday. There's a little bit of cottonol hanging out. Let me take that off. Yeah, so take some paracetamol. If that helps, carry on. If it doesn't, come back and see us. Okay?
So you want me to make another appointment?
Next week. Anytime
Do you want
next
me to
week.
make an appointment for next week, or do you want me to make an appointment next week?
Make an appointment next week.
So next week, if it's still there...
No, we still need to see you.
Do you?
Yeah.
So I'll make an appointment now?
Yeah.
I'll
Before
make
you
an
go.
appointment for next
If you
Wednesday.
can, yeah.
I'll do that.
All right?
All right, thank
Take
you.
care. Bye-bye.
It does look very suspicious. It damages trust.
I could regain the trust and I could bring my dad here. And
No, it's not your dad, it's you. The trust has to be with you.
Yeah.
Because, if there's a hint that you may be working the system.
No, I'm not.
No, but if there's a hint that so it is up to you to make sure that everything is absolutely above board and that it seems as if it is, that it's apparent and clear to everybody that it is above board. But if there's something that's not right about it, then that interferes with the trust between you and me and between the trust between you and all of the doctors who are available to help you. And so...
I'll promise you, I will... If I get medicated, I'll promise this will not
Well, you can
happen.
promises...
I'm saying it's...
Yeah,
I'm away from there.
Yeah, well, promises don't cut it. We have to be sure, in terms of safe prescribing, that that's what's happening. Managing how you choose to prescribe for any patient can sometimes be a challenge. In substance misuse, sometimes people are in this situation because they're afraid of being without their medication. Duplicity or deception isn't what they're trying to achieve, but it's their way of making sure that they're not going to go without. Our concern is not so much the deception, it's making sure that they're not unsafe and that in particular we're not contributing to a reduction in safety in prescribing. The point is that twice, on 2 occasions, you've gone back to Dedworth after you've had medication prescriptions here, and you've said that you didn't get a prescription here. And that...
Twice?
Twice, yeah.
No, that's impossible.
Well, I'll have to check this out because I can't issue a prescription unless I know what I'm doing. do not go back to Deadworth again. If you have any sniff of getting a prescription from 2 doctors at the same time.
I'll promise you that's not going to happen. This is just a misunderstanding.
And what we'll do is we'll need to put you on daily prescriptions. I know, but this is not my doing. This is you messed up here. And if you continue to do this, then we have to go down this route anyway, because there's no way out of this. So
I have to come every day?
No, you have to come to the pharmacy every day and pick up. And if everything is going well, then we can begin to relax the control. But that's what we have to do at the moment.
Thank you very much, Dr.
You're welcome. If they have any problem, they can ring up from the pharmacy.
Yeah, and you can keep a check if you...
Yeah, I will. I'll be watching it closely,
because I want you to regain the trust with me, because I've known you for a long time.
It's important,
it's important. I want to keep that trust. I don't want you to look down on me.
No. I wouldn't. I'd never look down on you anyway. This is just purely a question of trust.
Yes, that's what I'm getting at.
It's really important you don't mess up.
Yeah, so I'm going to prove to you that I wasn't. And
Do.
We'll take it from there.
Yeah.
Thank you very much.
Yeah.
Thank you.
You take care.
I'll see you in 2 weeks.
Yeah, absolutely. Yeah.
I used to sing in school.
Did you?
I used to be a big Britney Spears fan, so if we used to go places and then if something was getting delayed, my teacher would be like, go out stage quickly and sing a song. Oh my God.
I'll sing us one song.
No.
Please.
No. I wasn't dancing as well.
I remember when my eldest joined the choir and she was tone deaf and I said to her, mime. Don't sing, just mime.
How can I help? I had a lot of issues with my stomach. It was diarrhea continuously. Last 3-4 weeks I was suffering. Okay. The doctor done some test.
The stool.
That's correct. And still same issue, because I was suffering with overactive thyroid, but my thyroid levels are perfectly fine. Good. Because if the thyroid levels are played up, that's what happens as well. Then there's another issue might be. Still, I'm in the same issue. It's not getting better.
Okay. Your stool sample was clear, so that was good. Okay, but let's go through a couple of things. How long has the diarrhea been going on for now?
We're talking about 1 month now, isn't it?
Okay. And 4-week history of diarrhea. How many times a day are you opening?
Oh, Christ, sometimes back to back. 6 times.
6 times a day.
Easily.
6 times per day. Any blood or mucus?
I didn't see it. I should have, but I just...
Any vomiting?
No.
Any tummy pains?
When I have to go, start rumbling. I'm ready. It tells me, come on. That's it.
You need to go over.
Yeah, that's it.
And then
after that,
after you.
And then after, just calm down.
Any weight loss?
I tried to lose weight anyway, which I successfully lost, because last year I was 95, and now I'm 85 now, which is I want to do it because I cut down all the processed sugar and everything from my
And you've been
diet.
Exercising as well?
Exercise, I do lots of exercise, yeah.
Okay. And have you been abroad recently?
No.
And anyone in the family have any bowel conditions, like inflammatory bowel disease? Ulcerative colitis or Crohn's? May I have a feel of your tummy? Just going to gently press. No pain anywhere in the tummy? Nothing. That's good, okay. One of the examination that we should do if someone's getting persistent diarrhea is examining the back passage to make sure that there's nothing worrying that we can feel in the back passage. Are you happy for me to do that today? Yeah. Okay. Now what I want you to do is lie on your left side and bring your knees up towards your chest, okay?
Hello.
Hiya.
Come through, have a seat.
Thank you.
How are you?
Everything was fine yesterday.
Yeah.
I've seen the midwife, community midwife, because I just gave the birth 3 days ago.
Congratulations.
Thank you. So everything was fine, but my boobs, they're a little bit swollen. And what she says probably is infected.
Okay. So they're painful and they're swollen?
They're painful, they're swollen, they're big.
They're getting red?
Slowly but surely.
Okay. Any temperatures?
I don't know. I didn't check it, I'll be honest.
Okay.
I was so
Do you feel
tired.
well?
I feel okay, but it's painful. It's very painful.
Are you breastfeeding?
Not now, I think, because I'm just scared to do it.
Okay, but you have been?
Yes.
So you've been expressing milk?
Yes.
Ah, okay, fine. Okay, let's just check your temperature. And baby's okay?
Baby's okay. She's doing well. So I can't complain about baby. It's just me.
That's normal.
Do you want to come behind here? Okay, I just need you to take everything off, including your bra. Just sit on the couch, okay?
They're so big and wet and painful.
Okay, I'm going to have a feel. Okay.
Already they are painful.
All of them?
Mm-hmm.
Very swollen, aren't they?
Mm-hmm.
And tender.
And I have to say, yesterday was like half. Today morning is like double everything.
I think this one's worse than this one. This one still has some...
It still is painful. For me, it's both same if it's about pain. Maybe it's...
And the milk's coming out okay? Sorry, just 1 second. It's coming out okay? Yeah?
Mm-hmm.
That's fine. Get yourself dressed. So, yes, they are swollen, they are tender, and they are slightly red in some areas and very warm to touch. So I'd like to give you some antibiotics just in case there's an infection going on. So I'm just...
I don't think so. I can cope another day.
Okay. It's 1 tablet 4 times a day.
Okay. So if I had the antibiotic, can I still feed the baby?
Yeah. The one that I'm going to give you is fine to take while you're breastfeeding, okay? So it's absolutely okay to do that. They're not getting any better or still the same, you need to come back and see us, definitely, all right?
Okay.
There you go. All right.
Lovely. Thank you so much.
No problem. Bye-bye.
Thank you.
Bye.
Okay. Essentially, it was reassuring. Okay, so when anyone gets persistent diarrhea, there's lots of things that we think about. Okay, so obviously one of the things that we've got to rule out is infection. Okay, and normally, like I said, it settles down, but it's good that we sent the stool sample off. There was nothing that was shown in that stool sample. The other thing that we think about is inflammation. So there is another stool sample that I want you to do to look for inflammation in the bowel that can cause these types of symptoms. Does that make sense? Okay. Yes. The other thing, of course, that we think about is anything worrying going on, okay? And normally it would, there's lots of different signs and symptoms. So persistent diarrhea with blood, weight loss, etc. Does that make sense? Yeah. And there's a couple of other blood tests that I want to add just to make sure that we've ticked all the boxes to make sure that we've investigated you thoroughly. Does that make sense? After these investigations, if the symptoms persist, then we may need to get you up to the gastroenterologist specialist to have a look and see what's going on.
Okay.
Lovely.
Doctor, thank you.
No trouble.
I need to get to the bottom of this
yes, absolutely.
issue.
So I'll see you in 2 weeks. If you I'll see you in 2 weeks and then we'll move things forward from there. All right, Ben?
Thanks.
No trouble.
Thank you.
Lovely. Lovely to see you. Bye-bye now.
Trying to avoid that big blood vessel.
So it's painful. Oh, yeah.
Oh my God, no, don't go any further, please.
That's really hard.
Oh my God, no, please.
Okay,
oh.
so it's aggravating. I'm sorry.
How can I help?
Oh, just a couple of things really.
Yes.
First thing, I was in hospital again
Yes,
at
I
the weekend.
read.
The week before I was in, then again at the weekend, and they actually tried me on a different antihistamines, domperidone.
Oh, yes.
I've got them with me just to show you, make sure I got the name right.
Yes.
They actually gave me some that were out of date, so I needed some more.
Okay.
I don't know how, there's so many they have to deal with, but just it worked quite well because cyclizine makes me feel a bit sick before I feel better. But apparently these have their side effects as well, so I'm quite keen to try them.
You can, but in some people, these can have these kind of psychotic episodes where they get certain spasms of the neck and that kind of thing. It tends to happen more in children. I can give you a short course now, but I think it's for when you have the flare-ups.
Yeah.
I think long-term, stick to the cyclizine safer.
Tolerance to the other two.
Samantha is a 24-year-old patient of mine with ongoing chronic abdominal pains. She's under a hospital in London with the gastroenterology team undergoing numerous investigations. However, she's still getting these chronic intermittent cramps.
Because I'm on a lot, I'm on tramadol, morphine as well.
You're on, so I've got here propranolol. Are you still taking Buscopan?
Yeah, 8 a day.
Are you still on cocodamol?
Yeah.
Amitriptyline? Lansoprazole? Citalopram? And do you still need the Cosmocol?
Is that the Movicol?
Yeah.
Yeah, I've got some at home in the hospital getting quite a
So
lot.
if I go to add drug, it'll tell me whether these will interact as well.
I'm on tramadol and I'm on morphine as well.
See, there we go. So.
Oh wow, yeah.
But basically, having amitriptyline, citalopram, and domperidone, these affect the heart. Basically, that's the other side effects.
How often do you have it dressed, Queenie?
If you feel something sharp, tell me and I'll stop.
Yeah, I can slightly feel that. Actually, on my legs then.
Right, so there's quite a lot of discharge under dressing.
Come in. This is Holly.
Hello.
She's with us for the afternoon.
Right.
Alan, could you sit up on the couch, please?
Yeah.
Just saves me bending down.
Of course I will.
Lovely.
But without being, just Holly know I've got to drop your trousers, you know.
I'm happy if you are. Right, how's the legs feeling?
The right leg is on its 4th week, isn't it?
Yeah, 4th week.
If you have a look and you say it's okay, then I'm still on my 6-week plan. But the left leg is still a little bit oozy, but not much.
Alan has a condition called lymphedema. Lymphedema is a disorder of the lymphatic system whereby fluid is not being drained away from the tissues adequately. This can happen in any part of the body, and in Alan's case, it's in his legs. Alan's condition is lifelong. However, he has a very positive outlook on life.
Coming in for dressings regularly? Yeah. For a year and a half?
I used to come in every day.
Down to once a week now?
It's once a week now. It used to be every day, and Sheila would run and hide.
OK. So you're just having it put on like this with the yellow line over, are you?
Not on the right leg.
No, on this. We're just doing the left leg.
What that is,
that
they
bit.
put a little bit of the green.
Bit of green.
OK.
And then they've been putting the padding over the top of it.
Sure. It's really helpful if patients have additional support at home or family that will help them at home. Initially, Sally was doing some dressings at home to save Alan coming on a daily basis. And this was also freeing up appointments at the surgery for other patients that needed care.
So yellow lines just sort of essentially to hold it all on like a big sock.
Yeah. Right, this is my problem because I haven't got the strength.
Do you want me to get some gloves on and hold
Thank
things
you.
in place?
Maybe pull at the top would be easier for me, thank you. That's fine. OK.
That's fine. I'm just watching.
Do you want me to do the second leg?
No, it's fine. It's fine. Thank you.
I've been thinking about cake, and I've decided that I have to give cake a miss for a while. But I enjoy looking at it, but I'm resolved not to eat cake this afternoon.
So we won't force it on you.
Thank you. This is a bigger shock than Brexit. Yeah, Jim refuses cake. Yeah. It's such a shame.
I don't understand.
Look, this, I understand this. I have to slim down. Yes.
When was the hospital admission again?
I got out on Saturday, so I went in Friday early hours.
Is it for tummy pain?
Yeah, same as always in the
Is it right or left side?
Right side,
Right.
yeah. They think it might be a valve for my pancreas, but they're not too worried about it yet. They're trying to get the pain under control.
Oh, the sphincter of the valve.
It's
And
been
yeah.
for 4 years now. They're trying to get the sphincter problem under control. If it is that, I'm seeing Hannah Smith on Monday to sort of get more.
So follow-up woman at Hammersmith Hospital, is that next week?
Yeah, because I had Botox injected a few months ago now, beginning of April, and they want to see whether that helped or not. It hasn't, but they need to discuss
Where
it.
you had that injected?
In Hammersmith, they did an endoscopy, went back in, injected the sphincter muscle with the Botox.
Oh my goodness.
But it was trial and error, it's quite a new thing. Nothing's eased with the pain, but I was willing to give it a go. So now they might decide to inject more, or they might decide to try another treatment now. So touch wood, I'm just hoping something eases it, just so I can get back to work, you know. Just I want to get back to normal.
What do you
really.
do as your job?
I was in an office, I had a little office job, customer service, because I like talking, it was really good. But I had to let it go. I was a liability on my painkillers. I was not well. I had to let go.
And on these medications, are you driving at the moment?
No, I can't. I don't want to risk it. If I have an accident, I'd feel so.
Yeah, because some of these medications can make you
drowsy,
drowsy,
I
so
get
we
dizzy.
always have to advise against operating machinery or driving.
Yeah, that's one of the reasons why I had to leave the job, because it was in a warehouse. So obviously the machinery was going around and everything. It wasn't for me, you know.
Samantha is on numerous medications to help alleviate some of her pain. Some of them to help her nausea, some are to help relax the bowel. Other medications she's on are opioid-based like cocodamol and tramadol. One of the concerns that we have in treating young patients with long-term pain management therapies is that they can develop a physical dependence and even an addiction to certain opioid-based medications. Therefore, it's really important to keep these as a short-term use only at low doses and eventually try to wean them off these medications. And you're not taking any other illicit drugs, anything over the counter, herbal, nothing like that?
I try like multivitamins, but just to try and boost my immune system.
At the moment, carry on with the propranolol, the higher dose. I can see on the last consultation with one of the locum doctors that they put you up to 20 milligrams. Carry on with that 3 times a day. I gave you we increased your citalopram to 40 milligrams.
Yeah, I'm happy on that now.
So carry on with that, and I think let's see you again in 4 weeks' time with that.
Please, yeah.
And with the domperidone, as I said, it can affect the heart. There is side effects. I'll give you 7 tablets just for the 1 week now, and then after that, carry on with your cyclizine. Is that all right?
That's fine,
So just use them in an emergency if and when you get a flare-up. Is that all right?
That's fine. Thank you.
So let's do that.
It's just sort of keeping me comfortable to find out what's going on, you know.
Sure. There you go. Take care. Nice to meet you again.
Oh, thank you.
Oh, take your time.
Straighten up. Thank you very much.
Take care. Bye.
Do you want a job, Sally, over the summer?
I've got 2 weeks off. It's quite for Friday night. Well, if you ever get stuck over the next 2 weeks,
bless you.
Just let me know and I'll come in and help you.
We have a laugh because just as they patch me up with one thing, I get something else. I was rushed in for a triple bypass.
No.
Yeah.
We still can't get rid of him that way, can we?
Yeah, as soon as they're healed, I'll think of something else.
Oh, jeez.
Always fancied the lobotomy.
Behave yourself. I remember when the very, very, very first time you
That was
came.
you and Dr. Morris.
And I hadn't been here that long.
No. He made that drastic mistake, didn't he? He said, oh, God, shit, I think we better book him into our surgeries.
Forever.
Forever, by the looks of it.
And he wasn't wrong.
Done.
All right then.
Good job.
Right, is that it now, Sheila,
That's
for
it.
another 5 months?
If only. Right, so,
Have we got an appointment for next week?
Yeah, another one at 2 o'clock in the afternoon. Yeah.
Right, I'll have a look and see if that's me. I might just have a day's holiday. Right. Lovely to see you. Lovely to see you. Do you?
See you later.
Bye. Bye.
Bye.
I'll just leave the door for a minute.
Yeah, no, it's hot.
Because you have to put full stretch on it.
Yeah.
It's hard work.
Bye-bye, little man. Superstar. All right, there you go. Bye-bye then.
Thank you very much,
All right.
Doctor. Yeah,
Okay,
thanks very
nice
much.
to see you.
Yeah,
Thank
bye-bye.
you.
All right, thank you very
Best of luck, okay? Have a good trip. Bye-bye. Take care then.
Have a good day.
Bye-bye, you too.